Hello everyone and a very warm welcome to all of you into my channel A to Z Therapy with Smruti. This is your host Smruti Mishra. I am an occupational therapy and clinical psychology student. So come, join me on my journey of becoming a therapist and let's learn together. Hello and a very warm welcome to episode 2 of season 1 Talk with Occupational Therapist and Physiotherapist. Welcome to episode 2. A very warm welcome to all of you. And so today we have a very special guest with us, Mr. Anand Subramanian. He is a registered practicing physiotherapist in Canada and has been practicing physiotherapy for the last 2 decades, almost 2 decades. He has graduated from India. He has done his master's from India also. And in his initial career, 10 years or so, he has been assistant professor in various Indian institutes, and then he later on shifted to Canada for practicing physiotherapy. I heartily welcome you, sir. And today we have, today we
Thank you,
also,
Smriti and Dr. Yes,
thank you, sir.
go ahead.
And today we also have our founder, MH India founder, Dr. Hara Prasad Mishra. I would like to welcome you too, sir. And over to you, sir.
Thanks, Smriti. Yeah. So what to say about Mr. Anand? I just invited him to the podcast, and he was very gladly accepted our invitation. And I hope with all his insights to this rehab therapy and wellness, all his exposures and experiences for the past 2 decades will help us not only in rehab, but also this celebrating this Hara during this COVID time in a different way. All these evil thoughts and stuff. I hope you are also missing India, Mr. Anand.
I know, absolutely.
Yes.
Yeah, I love India.
Yeah. Okay.
India is in my heart, even though I'm in other country, but India is in my heart anyway. First of all, thanks to Dr. Hara and also Smruti for, conducting the interview. It's my pleasure and honor. Mainly, I love that my profession, I ready to, explore myself and, maybe this broadcast maybe give some hope to some people who is in the process of, clearing their exams and, looking forward for the future. Yes.
Okay. That's the main motive of our helping hand. Yeah. Over to you, Smriti. You can start now.
Thank you, sir. So, firstly, I would like to ask Mr. Anand about to give him a brief introduction and a bit of your background, your family background, your professional career, everything. So,
absolutely. Yeah. Thank you, Smriti. Actually, I'm born in Tamil Nadu, the place called Tiruchendur. Actually, I settled there. Native place is from Sangrangoil. How many people are familiar in Tamil Nadu? It's near to Tirunelveli district. And my dad is manager for Indian Bank, and my mom was a teacher. So coming from teaching background, there is no other choice. I have to clear that score more and get good grade. That's what my mom always taught me from the day one. So I learned, and whatever my parents I fulfilled their dreams and everything. I came in school second in my 10th grade and school first in my +2. As well as then I went to my, I was focusing for a medical field, especially, my parents are looking for, get that MBBS, that's what, coming from India, always looking to, either doctor, engineer or no more, right? Then, but what happened, my cutoff score came little low, but then I started applying. My dad only told, why don't you apply for physiotherapy? Matter of fact, when I was applying, I had no idea what is physiotherapy all about. Just he told me to go nearby Tirunelveli Medical College, go and get the application form, just apply. That's why I applied that. I don't know idea. Matter of fact, I got a approval for dental college as well as this one, physiotherapy, as well as I got an approval for engineering
good
also.
To know.
Yes.
Good to know. Yeah. So you all the family members are settled abroad currently?
Actually, myself, my brother are in abroad. Actually, I have one brother, and he's in Florida, and my parents are right now in India. They visited here, one time to Canada.
So Smriti, you can go with the next question. I hope Mr. Anand has absolutely answered your first query.
Yeah, absolutely, sir. So we are done with why did you choose OT? I guess if you want to explain a bit more, you can do it.
Actually, I'm a PT, right? Physiotherapist.
Yeah.
So yes. Actually, physiotherapy is a very noble profession, because I love it. Actually, when you start studying, I came to know the potential of physiotherapy. And when I study various conditions, matter of fact, when I started in 1995, I started my bachelor's. During that time, the awareness was very low. But still, we were, aware of a lot of conditions. Only thing is drawback at that time was, I couldn't able to expose to a lot of people. We just theoretically, we'll think about some conditions, and that was the exposure we started with. So yes. Then I went to
Okay.
masters. Yes.
Okay.
Yeah.
So how much you said that you did your bachelor's in 1995 and it's 2020. How much has changed through the time? And you have
Oh
since
my.
okay,
Yeah,
you can go
absolutely.
ahead. Huh.
Yeah, because there are a lot of changes nowadays. I can tell you the past and present. When I finished my bachelor's in '99, when I back to my my place, native place, started working in the clinic with the hospital setup, with the famous doctor, Dr. Ramurthy. When I started, people not aware of anything actually. In my place, I'm talking about my small town. No awareness at all, because then what I did is actually I creatively did a lot of camps along with the medical doctors. Whenever I go to some camps, free camps we conduct. So I started preparing the pamphlets and distributing to the people. So what is physiotherapy, what condition we treat, how you can connect with us, as well as
Definitely.
yes, yeah. So then actually I in my house actually in the front door, actually in a front wall, I started writing in our language. I speak Tamil actually.
It's in Tamil. Yeah.
Yeah. So I draw.
Advertising in its own way. Yeah.
Advertising one way, because just simply I did it. But
Yeah.
what happened is people stand in front of our house and wow, that for 2 minutes and then they'll move,
Yes.
and then
Yeah.
that way I
Staring with a
created.
very different look. Yeah. Staring with a very hazy look. Yeah. And that's a
Yeah,
common Indian scenario, the traditional and also the conventional. So what's the
absolutely.
condition now? Yeah. In 2020, how was you think? Because I think the
Oh,
technology and the thing coming to the kinesiology, the ultrasound machines, the heat machines, they have drafted also the imaging techniques have improved a lot over these years. Yeah.
absolutely. Now we are in the robotic stage. We don't
Yeah.
wonder. One stage,
Yeah.
robot will come and treat the patients. That's what the
Yeah.
advancement going on now. But the main thing
Yeah.
is right now, because of the technology, we're thankful to that. We have easily to learn, connect with people. Think about between
Yeah.
us connection. It is not
Yeah.
possible 20 years ago. Even making one phone call.
Definitely. Yeah.
Right? Yeah, absolutely. A lot of advancements now. We are really, and awareness is huge. That's what I can tell, that people know what is physiotherapy, and they're ready to come. They're ready to learn from the people. And main thing, take the advice.
Take
That's
sessions.
amazing.
Yeah.
Yes. Yeah.
Rehab therapy is improving. Yeah, it's on a ride currently, we can say, not on an exponential stage, but yes, on an integrative manner, it's definitely on a rise. Yeah.
Absolutely. Yes. Yeah. It's great. So it's booming now.
Yeah.
Yes.
Booming. Definitely. Healthcare is the 21st industry, 21st
Okay.
century industry. Just like the 20th, we have the industrial and the IT sector revolution. I guess
Yes.
in the latest coming 20 years, the healthcare will be driving the economy for most of the country. That's what the health tourism is all about. Yeah.
Absolutely. I agree.
Yeah.
Yes.
Absolutely, sir.
Yes.
So, Mr. Anand, how do you define wellness industry? And if you could throw some light on the various aspects of the wellness industry.
Absolutely. Wellness industry is a very wonderful one, because what I can tell with the proverb is that actually, prevention is better than cure.
Yeah.
And main thing
It's a
is
old is gold kind of stuff. It's a old and
absolutely,
gold kind of stuff. Yeah. The proverb still has a valid as it was 50 years back. Definitely. It is something
absolutely.
which hasn't changed with time.
Absolutely. And more than
Yeah.
anything, health is wealth. People looking for, making money and everything. But if we see the current scenario in the corona situation, people want to live the life, how they can protect their immunity and everything. So everybody's looking for the health now. People are aware of now, coming to the wellness industry. Answer first with this question, wellness industry covers a lot of field, So actually, Dr. Hara is coming from medical background. I'm coming from physio. There are different various backgrounds, people, acupuncture, Ayurvedic, homeopathy, Siddha, various, field people are there. Every field, focus is to,
Integrate.
recover,
Yeah.
integrate it together. When we integrate together and when we work unitedly, we can help a lot of people. That's a beauty,
Yes, sir.
Yeah.
So that's
That's the
what.
beauty of medicine. The teamwork has a got to role to play. I
Absolutely.
personally feel, I personally feel that the team spirit needs to be improved, especially in developing countries.
Absolutely, absolutely.
Everybody needs to get his own share of respect as well as financial benefits, because in India what happens is that somebody is credited more, but it's a teamwork, be it a healthcare profession or any profession. That's the reality. Yeah.
Absolutely. I agree with you.
Yeah.
Yeah, yeah. Because I like to add one more point, Dr. Hara, because as you're talking about the team, team itself definition is together, everyone achieve more. That is explanation of
Yeah.
TEAM,
Yeah,
right? So
absolutely.
Yeah.
here as a medical field, we all working together, without any ego or anything, but the ultimate goal is to help someone to recover better, and then they take care
Yeah.
of their family. Absolutely. Yes. Please go ahead.
So, sir, you told about recovering and so how do you define rehab therapy? Because as it is said that the quality of life is also something we need to look upon at. So, how do you define that?
Absolutely. You already answered the question of also want to live a quality of life, we need to live all the areas, especially physical, mental, social, emotional, areas. Everything is matter. It's not like only, living the life going. That's not the matter. You have to be spiritually connected, and also, you have to be, mind also has to be relaxed, peace of mind. So if you
Yeah,
want to have the peace of mind, your health has to be taken care. If your health is good,
absolutely.
everything will be fall in place, right?
Yeah.
Absolutely. Yes.
Absolutely.
Definitely. So moving on, as you have practiced, Anand sir, for 10 years in India, 10 years in Canada, both are different. It's
Mhm.
India is said to be a third world country when
Yes.
it comes to healthcare. But how do you think? And Canada is coming in the Western, be it the US or UK. Canada, it's one of the top healthcare industry, but it is run by insurance. The out-of-pocket expenditure is quite low. So keeping that in mind, how you see the difference in practice as a physician, as a therapist in both the
Absolutely.
scenarios?
Absolutely, because so I can give you the comparison both sides as well as a plus and minus. Because I'm not here to tell only if I'm living in Canada, only Canada is the best. Not like that. Because I
Yeah.
love India. The thing is, even till today, I'll talk with my patients everyday basis. I will talk with my clients here when I'm meeting. What happened is actually in India, education is great till today. Because we love a lot. We study in depth of knowledge. Compared to other countries. I can strongly tell that because coming from India, because we study, our lecturers, our from the school to college to even, all the field, we'll study in depth, unless until we study in depth, we cannot be able to clear the exams, very depth of knowledge,
Yeah,
so
that's
that
the
is amazing.
competition. Yeah, that's the
That,
beauty of competition in India. Yeah,
yeah, everybody loves.
yeah, it brings out the best. You have no choice. Yeah.
Yeah, absolutely. Even Canadians, when I meet with them, oh, you people are very good. You people are educated more and everything. Every country people are appreciating. So who are in
Yeah.
India are watching that, don't think that only going abroad is the only solution. See, wherever you are right now, focus on your career and study in depth of knowledge, not for just for the namesake of clearing the exams and everything. Study in depth and go a little more extra miles to learn in depth of what is going on right now, current technologies. Learn right now, because even if you are planning for abroad in future, try it right now. The time to start is now. Don't you need to wait to career to complete, then you have to explore and then study advanced courses and everything. No need. Whatever you are studying, that's more than enough. Matter of fact, tell the truth, I studied everything in India only. Just I came and clear exam. I never go for any exams in Canada, even though they told me to go for initially 10 courses. Then I showed all our credentials from India, our research, whatever I did, with the bachelor's and master's, automatically they approved that. They told, okay, no more, you don't need to go for any courses in Canada. You are eligible to go for, your exams, theory exams and, practical exams, especially for our field. The
Yeah.
thing is, when you come to Canada, it's not an easy thing, guys. Actually, I break all the bridges, whatever we have, worked as a assistant professor in college, 10 years in India. What I did is actually after my bachelor's, a few years I was working in the, hospital as a therapist, run my own clinic there. And then, doing the camps, as I told you, then I realized that only bachelor is not enough because I see the income coming in and, same routine. Then I thought, I have to go move forward, when I went with my MD, physician, Dr. Ramurthy, I asked him and I want to go for higher studies, then he told, okay, go ahead, do it, my parents also encourage, don't think about money, just to study, like that. So that's my parents are the great motivation for me. So then I went and did my master's, then I started exploring. Then I worked in the college as assistant professor in Chennai, college, and then I moved to Mangalore,
Yeah.
University College of Physiotherapy, worked as assistant professor there, right? So this is a year, 10 years I was spending there. At that time, I learned a lot in not only theoretical,
Yeah,
practical point of view.
sorry to intervene, but I want to know what comes, because in India, whenever some patient comes to a physiotherapist, most of the times the sessions are out of the pocket expenditure, most of the times. But in India, because the fact is that in India, if a patient is having an insurance, it is for a small amount and it doesn't cover physiotherapy. Yes, the bigger amounts, the 50 lakhs or 1 crore insurance, they do cover, but on a larger scale, the majority of the population either go for the out of the pocket expenditure, or their insurance doesn't cover the whole of the physiotherapy sessions. But I think in the Canada, what I know is that most of the things are covered over the insurance. So how do you feel, keeping in mind the perception rate, the patient follow-up rate? How do you think the difference is there? Yeah.
Absolutely, absolutely. I can explain that. Even, I use the terms here also, with, because in India, money is an issue, but the treatment is available. For example, anytime if you want to go to any specialist, you can walk into their clinic. You no need to ask for anybody's permission. But it is here in Canada, it is not like that. Even if you want to meet any simple specialist, you can meet your physician, because here everything is covered with a health card. Main thing is, you can consultation, everything is free. Some of the medication when you want, you have to go with the insurance. That's what the thing. And even any surgeries are fully free, fully taken care. But the thing is, the difference from India to here, if you have money in India, you can go to surgery tomorrow itself. But here you need to wait for some times, get the specialist appointment. We take a couple of months. If you get it right away, you are lucky. I'm living in Brampton, Ontario. I can tell the scenario here. Different province, different protocols. But here, some hospitals near to my hospital, if you go there, the waiting list is more. And even you can want to for any surgeries for your fracture or any cardiac issue, you have to wait for some time. But overall covering is that health card. Everybody will get the health card.
Yeah, the insurance factor is different. Yeah, that's
will
the
cover.
same. That's the same scenario with NHS and all the developed countries. But I think in coming days the things will be more sorted. I hope it's for the benefit of the patients, both in India and also in abroad countries, because time is also a factor when it comes to health that needs to be prioritized. Yeah,
absolutely.
Yeah, moving on. SMRUTI, I think you should be having some more queries for Mr. Anand.
Yeah, sure, sir. So I would like to know how much acupressure, because acupressure is such an old art of medicine. So how acupressure is can be used in the therapy, or if you could just describe the whole process or the importance of acupressure in therapy.
Absolutely, because matter of fact, I did my MD in acupuncture with Colombo University. When I was in India in 1999, there is one famous author called Dr Ananda S. He's a father of acupuncture. He's no more now, and he came and taught us, and under the help of Dr Paul, in SMRUTI Hospital in Salem. I did my, acupuncture course, then I did a lot of acupressure courses and everything. Acupuncture in short form, main thing is it's about, Chinese medicine, right? It's a traditional way of approach. Till today in China, they are treating many patients with only acupuncture needles. Acupressure is, they are touching that points, the points of our individual channels, it covers our whole body. It's called yin and yang. Whenever there's an imbalance happen in our body, that time only we got that, conditions, pop up, pain and, some other symptoms and everything. So by placing the acupressure in the particular point out which problem, which area it's happening. When you press at that particular point, automatically we can see the improvement recovery, So what beauty as a is combining that acupuncture together, because many of our equipments are made together right now. Acupressure combination of TENS machine, lot of things came up already there in practice. So when we combine that acupressure with the physiotherapy, recovery is very faster. Here in the physiotherapy we treat like motor points, we stimulate for any nerve injuries and everything. The same with acupuncture also. They'll find that individual organs point, then we'll activate the the channel of circulation and everything.
Absolutely. It was a very detailed explanation for the audiences. To summarize this point, I would just add 2 to 3 more things for simplifying for the audience who do not come from a medical field. So the basic fact is that we used to have a term called dermatome. That is, every part of the skin is supplied by a particular nerve root. So what we exactly do is that in acupressure, we target certain points what Mr. Anand explained. The simplifying the point is that we identify our target, and without touching the organ, by external pressure, we try to manifest some changes in the organ or in the ecosystem of the body. That's the reality. Without going inside, by stimulating from the outer environment, we are trying to create changes in the internal environment. So that's the scenario. It was a wonderful discussion about the acupressure. Moving on, what do you feel, Mr. Anand? Because PT is also all the fields, be it medicine or any kind of allied health sciences, we are approaching towards a subspecialty, fellowships kind of thing. So
Mhm.
what I feel is that PT is more into pediatrics, mental health and stuff. Could you brief out what is the need of PT for pediatric, cancers, mentally retarded children? Briefly.
Oh, wow. It's a vast area, briefly, yes. Actually,
Yeah.
I did my specialization in pediatric neurology, so when I was studying, I'm not very good in neuro, but I end up taking neuro background, right? So now I love neuro field, Matter of fact, I was teaching for the students in neurology. So pediatrics
Yeah.
population really play a major role, because what happened is many say like a pediatric conditions, cerebral palsy, muscular
Yeah.
dystrophy. Maybe we'll talk about this topic in detail one time, a separate, session
Yeah.
for pediatric
Yeah.
itself.
Yeah.
But for the brief idea for as Dr. Hara mentioning, is that main thing is, pediatric population we can help, as a physiotherapist. Matter of fact,
Yeah.
even in Canada, I'm seeing, 1-year-old children and, even 6 months old child and everything. What happened is
Yeah.
when
Also in autism and ADHD, do you think PT has a role?
Absolutely, absolutely. We work on
Yeah.
with the symptoms. Whatever they are having, the situation. We as a PT, we play some role, and the occupational
Yeah.
therapists play a role. As in the medical
Yeah.
field, they will take up their medical conditions. So we'll
Okay.
work on their physical activities. If they have the
Yeah. Yeah.
limited movement or spasticity, means tightness of the muscles. Sometimes the weakness in the muscles. They have difficulty in the balance and the coordination.
Okay.
And the motor delay. That's called
Yeah,
the
I got the
developmental.
point. I got the point. Yeah.
Absolutely, that is
So
related to
yeah,
pediatrics.
yeah, yeah. What about cancer? Because cancer is a palliative condition. It's an
Yes.
end stage. So I think in pain medicine you have a role with addition of acupuncture and stuff. Could you throw some light on that?
Absolutely. For cancer patient, what is a symptom is mainly, there are different stages. Any stage when they start going through, they have the severe body pain, and the tiredness and also the weakness of the muscles, and
Yeah.
they feel like all the time they like to sleep and everything, and there are a lot of symptoms they'll face, and also mentally they'll disturb, when they hear about the condition, they put themselves down and, so, a lot of depression, a lot of things are going on their mind. As a physio, what we do is when we go there, we'll work on our, physios. We motivate the people. And main thing is,
Okay.
we'll work on build their muscles and then be active. At
Okay.
least,
Yeah.
even though they couldn't able to do too much, depends upon the severity, we take them to at least work for the ADL. That means an
Yeah.
activities of
Functionality.
day.
Yeah. Yeah. You work on the
Function.
functionality. Yeah. Yeah.
Functionality.
That,
Is,
yeah.
something is better than
That's
nothing.
the main thing. Yeah. Yeah. That's the
Yes.
main thing we want the
Yeah.
patient to have to survive.
Little
Yeah.
better, yes.
So, yeah, what about the functioning of a rehab team? Because what I feel is that a rehab team needs to work in a functioning manner with a proper teamwork, with a proper script in mind, how to approach a patient. Yeah. Could you
Yes.
throw some light how a team of rehab works? Means what are the components, be it a nurse practitioner, the NP, from a PT to a PTA, the PT assistant, from an orthopedic surgeon, how the
Yeah.
team works? Yeah.
Actually, especially you're asking for a question for the cancer patients mainly, or
No, no,
overall?
no, 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 no. In overall, in the
Okay.
rehab center, how our team works?
Oh,
Yeah.
okay. Actually, because as we talked about the teamwork, right? Teamwork makes
Yeah.
our dream work. Here the dream is to help the people to recover faster, right?
Yeah.
So when
Yeah.
actual, for example, if there is any problem, especially about the musculoskeletal, anything related to the bone and joint issues, orthopedician will refer in India. That is a setup, Then we'll come to
Yeah.
physiotherapy. So when they refer to us, when we have the mutual connection with the orthopedic surgeon or anybody, so who are referring, we can clarify
Yeah.
with them. Neurologists, they refer to us, cardiologists. So we will, when you interact with the medical professionals, they will tell that, okay, this is a situation, can you please address on this? Okay.
Yeah.
So we get a
Definitely.
clear idea, because otherwise we don't know what's going on inside. We think only the problem in the, problem in the shoulder, for example, but we don't know what they're going to their neck or any other fracture happened before. We don't know idea. So the orthopedic surgeon or anybody knows about the problem. So then when we get a clear idea, so then we can treat as a whole. That's what I do from my day one to now. I don't treat only the particular area of the problem. I treat as
Yeah.
a whole.
Getting into the root cause. Yeah.
Okay.
Getting into the root
Yes.
cause.
Absolutely. That
Yeah.
as I give an example. For example, there is one water leakage happening in your house. Instead of just mopping the particular floor, water coming out, but better find where the water is start leaking. So you have to block that area.
Yeah.
Same thing
Yeah.
here. We have to find the root cause, as Dr. Hara mentioned nicely. So we have to root the cause. If we treat nicely, automatically the patient will recover faster.
Yeah.
That's the
Yeah.
teamwork.
Yeah.
Absolutely.
For all the upcoming medical professionals and health professionals, I would just add one thing: don't look for shortcuts. Don't look for the jugaad, the traditional word, the famous saying jugaad. In India, it's very famous,
Absolutely.
but I will say stick to the long cut, stick to the proper methods. That's what the reality is. Yeah.
Absolutely. Yeah.
Smruti, I think one more question you have for
Yeah,
Mr. Anand.
yeah. So if you could tell us about your future aspirations, seeing the future, what rehab and physiotherapy has. So if you could just say what are your aspirations are.
Absolutely. Thank you, Smriti. Actually, because I love this profession, even though 20 years experience, 21st year in the field right now, I till today, it's a helping people, right? Because when you are coming to the medical field, you must have a different mindset. It's not like in our other field, because here we have to be very close enough with the patients. Sometimes they will be, the emotional, they are going through some situation. We have to patient enough to, address their questions. Listening,
Yeah.
listening play a major role, because it's like a mutual connection we are creating with the patients to us. It's like they're going to treat you as one of the family members. So whenever we are treating the people, we treat them like one of our family member, instead of treating as a patients to only just to make money. We have to give our heart and soul to the people. So my aspiration is to reach out to more people, help more people, through this wonderful opportunity, wonderful field, whatever we go through. Because I'm in this physiotherapy profession for some reason. God is putting me in this field to help more people. That's what I do. Here I'm going to connecting with a lot of people here. I'm working the community setups in Canada. I'm working from the newborn child to that end of their life people. I'm seeing all the age groups everyday basis. So when you go there, we are lightening up their life and the mood for the particular time frame, and they will think about us, and then they will become motivated and encouraging. So as a professionals, we can help a lot of people and inspire others, and everybody live a better life, great life.
So Smruti, can you just summarize what all during this podcast Mr. Anand has gone through? I think Smruti is having your slides.
Yeah, so sure. So we will just 1 second. Yeah. So we talked about Sir's professional career, where he started, and a bit about his personal life. And so it is all about how he started, where he studied, and how he has worked. We know that he has worked for he has been working for 20 years, 10 years in Canada and 10 years in India. And this is all about why he chose physiotherapy. We know that initially he didn't want it, but later on he loved it. Yeah, and this is how the scope has changed. The only thing that is constant is change. So change. This is all about how he defined wellness industry. As we know, prevention is always better than cure, and health is wealth. So it is all about that. And it is all about describing rehab therapy. We talked in detail, quite detail, about rehab therapy. And Mr. Anand also emphasized on what how he sort of moves forward with the rehab and everything. And it was great talking about rehab therapy with him. I got to know a lot. And this was all about the difference in the practice style in India and Canada. As we got to know the education system, as students, we feel that the education system may not be so good, or we always, as Indian students, we always think that the foreign countries are much better, but that's not the truth. We got a reality check, maybe.
That's true.
That was great. Then we talked about acupuncture in detail. Our founder, Dr. Hara Prasad, and Mr. Anand had a great talk on acupuncture. It was really great. Then it was about the need of PT in pediatric care or cancer. As you know, we talked about it, that it's like PT is all about starting from the neonatals to the geriatrics. So it was great about the mentally retarded, the geriatric population. Uh, and this is about the future aspirations as a physio Dr. Anand has. And as he said, that adding value by unconditional service is the attitude. And I think that's all we talked about. It was great. And over to you,
Yeah.
sir.
Yeah. So, Anand sir, it was great to have you on this podcast. A one-liner message to all our audiences, especially not from the medical background.
Mhm.
What do you want to say from as a healthcare professional to all the listeners who are on standing on the patient side from a non-medical background? Because we have a very different background of audiences coming to listen to our podcast, be it from the medical students to healthcare professionals. So, special message to all those who are from the non-medical background and who may be a future patient looking for care. Yeah, a special
Absolutely.
message to them.
Yeah, yes. My message for the patients is, first thing is, you trust our people, professionals, because coming from India, when you're living in India, our all medical doctors to all the medical field people are, very knowledge, and, they are ready to help you, so you have to be trust first with our people. And then, whatever they are recommending, we need to start listening to them, because,
Yeah,
their intention is to help you to get better, so, and then go for the attention right away. Because, for example, whenever you have some situation, you have to go to the checkup. Don't take it lightly, it will be all right and everything, better to, when the problem is very minimal, acute stage, if you go and recover yourself, you don't worry about when it becomes severe, and go for regular checkup, don't wait only the problem comes after that, if it is very hard to maintain yourself. So whenever
yeah,
you feel minimum symptoms, better to go right away and fix the
yeah.
problem so that you feel
Yeah, to
good,
cut it
will be
short,
a healthier.
Yeah.
To cut it short, what Anand sir said is that prevention is cure. If you have any issues, go seek help. That's all. Don't have any kind of mindset that what will happen, this will not happen. Go seek and help. That's a simple, clear-cut message from our PT sir from Canada. And a
Absolutely.
special message for all the healthcare professionals who are working during this COVID pandemic.
Oh, sorry. Tell me again.
A special message for the healthcare professionals who are working during this difficult times. Yeah,
Absolutely, absolutely. And I salute the people who are working in the health field, because, if you see that health professionals are, they also have the family, even though they make money, but they are risking their life and coming to help you guys, so you need to respect me. I need to admire with all the health professionals who are watching, I really salute you guys, mainly, your dedication. I really appreciate. And more than anything, take care of your health as well. Families depending on you. At that time, you are helping a lot of people. Keep doing the good
yeah,
work and help more people and live a
yeah,
better India. That's very
yeah,
important. Yes.
yeah. That's the call. Local for vocal and Atmanirbhar Bharat. Yeah. Any
Absolutely.
special message for the upcoming future aspirations, future people who or the students who may be opting for various medical and allied health services in future? Special message for
Absolutely.
them.
Absolutely.
Yeah. How
Absolutely.
do you
For
think?
the
Yeah.
student,
How do you think? Yeah. How do you think? What is the future of healthcare in India and abroad as well in this
healthcare field is
21st
always
century?
absolutely, it's evergreen. Actually, especially 21st century is wellness and networking. Who you are connecting is
Yeah.
matters.
Yeah.
The main thing is, when you learn about the skills very nicely, it will be there with you for the lifetime. So spend a lot of time to study. When you are as a student, don't waste the time in other, in the social media, because a lot of distraction happening nowadays. Thank God when we are studying, it is not there. Even I don't have the mobile phone at that time when I was studying,
Yeah.
but now
Yeah.
everything
That's
is
a
again.
very great brain. Yeah. That's a
The
great boon
distract.
in those times. Yeah.
Absolutely. There are a lot
Yeah.
of distractions are around, but you have to be focused on what the reason you join, because you are going to help, you are going to, work with the human being, because we are totally different from other background people, because as a medical field, anybody, we are touching with the human life, if you
Yeah.
study in detail when you are studying, you can able to help little more to recover them faster. Okay. So focus on the studies and enjoy your time, no problem. But at the same time, dedicate study in depth of knowledge, that will be there for your lifetime and help a lot of people,
Yeah. Yeah.
Yes.
Yeah. To add to
Absolutely.
this, I just want to say I just also completed my medical education, and also I'm looking up to complete. As you all know, that medical education is something we all have a long time of learning and relearning. So a special message from my side will be that don't look up to your future colleagues and fellow colleagues and from other fields, be it the IT sector guys or all others. Just remember, work hard. You will also be having a good Mercedes with you and a good a house and stuff, and you'll be having a good money in your bank account. Also, the most important thing, you'll having a good fate and a good night's sleep. That's all from our side message. And it was great to
Absolutely.
have you, Anand sir, on our official podcast.
Absolutely.
Smriti,
Thank you very
anything
much.
you want to? Yeah,
Well, I
Smriti.
would just
Yeah,
conclude. I would just like to conclude the talk. It was great talking to
yeah,
both of you, sir,
yeah,
Anand
and
sir,
also,
and
yeah. Add to it. Yeah, add to it. You must be sharing some pictures
okay. I think
of
I have
Anand sir.
already shared it.
Yeah.
Okay.
Okay. Anand sir can
Okay.
add to it anything special about your family members
Yeah.
No,
and your life
absolutely.
at Canada. Yeah.
Absolutely. She's my wonderful wife, Uma. She's my back support for here, in Canada, we
Yeah.
got married. Now we are 14 years we completed, and we are
Yeah.
blessed
That's
with
good
one
to know.
daughter.
Mm.
Yeah,
Yeah.
blessed with one daughter.
Yeah.
She is right now in 8th standard, and
Yeah.
really pretty good actually. And my parents are in India. This is our another
Okay.
pictures. We took it there. So more
Yeah. Yeah.
pictures. We can see. My parents. We are
Yeah.
blessed with my parents, and Uma blessed with their parents. They are very support
Yeah.
for us right now. They are
Yeah.
for
Yeah. Definitely.
encouraging us, and it's
Yeah.
a great life. Yes.
Yeah.
Yeah. It's good to have
Absolutely.
you on the official podcast on this special occasion of Durga Puja.
Absolutely.
Special
It's
wishes
my
from
pleasure.
India. Yeah.
Yes, it's my pleasure. We'll do more, and we'll give more awareness to the people. So
Yeah. Yeah.
wish you all the
Therapy is
best,
something.
everyone.
Yeah. 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 Especially being the founder of this organization, I am having a great view for this country, because when our Prime Minister reiterates that it is Atmanirbhar Bharat, it's we the Indians, it's the fellow citizens who need to come up, and not the country,
Absolutely.
not the government. We can't seek everything for ask for everything to the government, that yes, the government needs to do this and that. We need to stand for it. And I hope all the fellows listening out, we will act together for this Atmanirbhar Bharat, and one day India will be having a great country, so we can all pride upon. Thank you, Anand sir. Over to you,
Absolutely.
Absolutely.
Smriti.
Yes,
Yeah.
yes.
Thank you. Thank you.
Great.
Thanks a lot, Anand sir. Thanks a lot, Dr. Hara Prasad sir. It was a great event talking to you all, to both of you. I think I wish. Okay.
Awesome.
Oh,
Thank you, Dr.
thank
Hara
you.
Prasad, and also Smriti for conducting the time. This session
Thank you,
was
Yeah,
sir.
yeah,
welcome.
it was
Yes,
great to have you, sir.
It was great.
Okay,
absolutely.
thank you, sir.
Welcome. You are
Thank you.
welcome. Thank you. Take care.
Thank you.
Bye.
Okay,
Take care.
bye,
Bye.
bye.
Bye.